So, it came in like that. So was she right? Yeah, that's what you do, phlebotomy. How many of you know what phlebotomy actually is?
Draining the blood?
That's actually drawing blood, entering a vein to get some of the blood out. Now, most of the time when we do phlebotomy, what are we doing it for? Just to collect the blood sample. But sometimes you may need to actually get rid of some of the blood. That was one of the treatments that was used many, many years ago before people knew what was what as far as medicine is concerned. They would always say, bleed them. So you think they cut open a vein, what did they do? They put a leech on it.
You said the ME normal ratio is 4:1?
Normal ME ratio is 4:1. And this thing is the opposite direction. And you got one myeloid cell for 4 erythroid cells. So it's flipped. It's the opposite direction.
Question.
Yeah, what?
Yeah. The amount of blood that you have to.
I can't hear what you're saying.
I was asking how much blood you need to drink.
How much blood do you drain from it? Enough to get the PCV back down toward normal. And like I said, is that going to be 1.2 million? I don't know what it is. You know who does know?
Did you say what cost it?
Yeah, I just know that's what they do to treat. Now, exactly what is the formula for how much you down? Yeah.
Would there be a concern with like removing a lot of the mature red blood cells and then leaving the younger ones?
Yeah.
So how would you like play that balance?
In a case like this where you got this many, it's probably not going to be that big a deal anyway. So now, of course, you check afterwards to see what you got after you start doing this. But right away, you say, "Well, could I drain something right away?" Yeah, you know, with that kind of situation, it's probably not going to really do anything to really upset that right on.
So what caused his polycythemia? What caused his polycythemia?
I still.
What caused it?
What caused it?
Yeah, do we?
That's the $64,000 question. What did I tell you this was? No. What's the overall answer? This is a neoplasm. This is a neoplasm. So you say, what caused that?
So just.
Most of them we don't know. Okay, especially in animals. How many of you guys went to the symposium yesterday afternoon and listened to the guy talk about prostate? Okay. What did he say? He said you can predict who will get prostate cancer based on genes that they know are associated with the development of it. Also, you can look at response to therapy based on analysis of the genome in these cancers. So once you know what genes are there, you know what they do. So you can say, oh, well, this one may require vitamin C or something. So as a result of that, what I do? Well, I can reduce the level of vitamin C, but that's tricky too because you got to make sure you don't give the person scurvy. But that kind of thing you can do. Now, remember when we were talking about genetic stuff back in the beginning? And I told you that the way of the future was going to be that kind of thing? Yeah. As far as animals are concerned now, we have a fairly good idea about things like mast cell tumors. You know, what kind of genomes make those up? And also what species will be more likely to get them. And not only that, but within the species, what breeds are more susceptible to it. So we kind of know that from just looking at who gets it. But there's actually genetic evidence to show why that's the case. So this is the stuff that's coming in the future. You have to be aware that kind of thing may happen. I don't really know what caused this neoplasm. So, but someday one of you bright folks are going to figure out exactly what the cause of that one was. Okay. Here's another dog. This is Atta Girl. Sometimes I just try to put something in here to make it look funny. This is a 9-year-old dog. And she has exercise intolerance and is losing weight. So, what else would you ask the owner about this? Especially if they told you you had difficulty breathing. What would be one of the first questions you ask?
How long?
Well, not only that,
Is she on her?
you're in Alabama. What's one of the first questions you'd ask?
Is she on a heartworm preventative?
Well, she on heartworm preventative. And that also means that she looked at her stuff ahead of time. Or either flipped a couple of forms up. Yeah. But anyway, yeah, you'd ask about how long they had this, do they have it at night and during the day and all that sort of stuff. But one of the things you need to look at is where you are and what's likely to be the cause. That's one of the things that Dr. Cassidy calls playing the vet game. Okay, so let's get some blood and look at what we got in the blood. What's this pattern show us over here?
Dr. Van,
Yeah.
what are moist reels? Previous life? Oh,
Listen.
okay.
Listen. If you got a stethoscope, that's what you should normally hear. Now, suppose you're listening here. What's that sound like? Bubbles, okay? So that indicates fluid is present in the lung, okay? Moist reels. Now, suppose I'm listening and I hear. Wait a minute, let me do up here, because somebody, what did you do? What's that? My hand is getting warm from doing that. Why is it getting warm? So what do I call that? Friction rubs. And what would probably cause that? What's this sticky stuff that can get on the pleural surfaces? Fibrin. So that's one of the things that can do that. So another thing you can hear is when you're listening to the lung, I tell you, I can't hear that. That's normal. That's called a harsh rate, okay? And that is air passing over inflamed membranes, okay? That's the kind of stuff you get with asthma and things like that, okay? Okay. Now let's look at our blood, at the hematology. What's this telling us over here? Stress. And what else is it telling us? Possibly parasites, because you do have an eosinophilia that's higher than what you would normally get. Okay. Now what about down here? Now albumin is low, but our total protein is high. What do you think is happening there? Probably dehydration. So what does that mean as far as our PCV over here? It's probably artificially high. Okay? Now, ALT, AST, CK, what are those things associated with? The liver and muscle. So, you think the liver might be involved here? Yeah, probably muscle too, man. I said she was thinner than normal, so there's some muscle wasting. So why do you think there's muscle wasting?
It's not active because it can't breathe well.
Well, maybe some from not being active, but there's another term too. It's called cardiac cachexia. And what that means is that there's wasting. Cachexia itself means wasting. And this can be due to heart failure. Why do you think that might be the case? Normally, you have to have sufficient blood flow in order to utilize the calories that you're getting from the diet, right? If you don't get the stuff to your cells, you're not gonna use it. So the energy balance gets to be negative in that type of situation because you actually can't deliver enough of it to the cells that need it. So that results in this cardiac wasting. People that have prolonged heart failure usually do have some muscle wasting. And it is partly due to inactivity. But a large part of it is due to just simply not being able to get enough nutrients to the tissue. Okay. The urine doesn't really tell us a whole lot.
Question.
Yeah.
So in this case, like in the clinic as a doctor, if you were like thought it was heartworms
Mhm.
just from your exam, should you just run the heartworm test if you get a positive, or would you still need to run the full CBC chem just to test for other things also?
Answer your question. Did I answer your question?
Yes.
Okay, let's back up. Now, this is what we also do, and that's a radiograph, and you probably do EKG and all that too. This is normal, and here's the radiograph from this dog, and you can see a couple of things right off. Look at the lung here. See how dark this is? Look over here. What's that probably mean? Fluid accumulation in the lungs. What about the heart? That's a normal size. That thing looks like a basketball sitting in there, which it is. And there's something right here too. Can everybody appreciate that little bump right there? If you can't, it's there anyway. That's what's called a prominent pulmonary knob. And why do you think that's there? Now you know now what this dog has got. So why would we see that? That's a prominent pulmonary artery. It's a big pulmonary artery, dilated, and it's due to what? Okay. And when we look at the left, the lateral rather, this is also a giant heart. And note the trachea coming here on this one, and it coming here on this one. See it drop as it goes across the base of the heart? And that's straight, which means that the heart is big, left atrium is big, especially in pushing it up. So that's the case. They'll also tell you about cardiac waste, anterior and posterior. And what that means is the shape of the anterior mediastinum and the shape of the posterior mediastinum. They should look like this. And what's up here? Well, you got a lot of stuff clouding that, and the heart is a lot further forward in this. So you have reduced anterior cardiac waste and also reduced posterior cardiac waste. So they'll tell you about that in radiology and exactly how you measure it. And it does have heartworms. And that's what we see. What about the right ventricle? You think that's hypertrophied? It is. Even if you don't know, it is. And here it is over here. Here's the liver. Completely out. This is inside the abdominal cavity. Why do you think everything looks so shiny in here? There's a hint back there. Yeah, fluid, ascites. That's what you call that in the abdominal cavity. So that's why the serosal surfaces look so glistening when you look at it here is because there is fluid in there. And the liver is big. And when we take it out, it looks like this, nice rounded edges. And if I cut across it, what would I see? Same thing we showed you before in the nutmeg. And there it is. That's a nice close-up of it. This is a little better picture than the previous one I showed you. But that's this nice alternating light and dark coloration. And when I look at it histologically, I do see a lot of fibrous connective tissue in the area of the central vein. And why is that? Because that area has died. Why has that area died?
It's more susceptible to loss of oxygen.
Remember blood flow in the lobule. They explained that to you the other day. And I did too before that. That's where you have the lowest oxygen tension, is in the center of the lobule. That area will die first and be replaced by fibrous connective tissue. Coming from the outside, you have the hepatic artery coming in there. So that area suffers less from hypoxia than the interior of the lobule. Okay. So what is it? It's a chronic passive keep using the old word, chronic congestion, and it's generalized. This is from heart failure, right side of heart failure and heart. Okay. Where is she?
Right here. What's up?
Okay. We'll start the next one in the next hour.
Next hour.